there's a congestion. There's so many physicians in urban communities, and we're having a problem in rural communities. Is the medical community working with other areas, so the business community, the law community, other communities to help bring physicians into rural areas?
I don't know that we see communities as much. I really think a lot of that revolves around the hospital. Now, I am aware of some communities in Missouri that have actually sponsored scholarships for students from those communities who plan to go on to medical school. They come back then in exchange for those, provide some service in exchange for those scholarships. But I think by and large, it has been left to the healthcare community to try to provide those incentives and to coordinate the programs that could allow for loan repayment and things like that. Jeremy, you were going to?
Yeah, the main thing that I was going to point out, and you kind of hit on it, was really the loan repayment component. I think that's something that's very intriguing to medical students going into school from the standpoint as far as paying down their loans. I know I'm from Kentucky, and there's very rural parts of Kentucky, as you all well know, and oftentimes there's opportunities where you could help pay off the med students' full debt over a number of years. So I think as we continue to move forward, we've got to be creative as far as the way that we're thinking to bring these bright clinicians to our rural community. And for us, I think it's about, as I alluded to earlier, identifying the talent, not just in the large urban, cities. It's really looking at the rural areas as well as making sure that we're aligning and we're working with them throughout their journey through med school. I think that's very important for us in the more rural Illinois, but also I think it's important to ensure that we educate people as far as the needs that we have, and we partner and we collaborate with other universities that can help us bring these type of students as well as these medical physicians to our rural markets.
Thank you.